Namaste. I'm Dr. Madhumitha from Infectious Disease Department at Apollo Hospitals. We're celebrating this immunization week from the 24th to the 30th of April. What is immunization? In simple words, immunization is nothing but the body developing immunity. Take a vaccine, your body develops immunity against that infection. So, when we talk about vaccination, we always think vaccination, immunization is always for kids. Well, that is not the way. Adults also require certain vaccination because as we grow, our immunity starts waning. That is, it starts decreasing. So, we need to boost our immunity. I always say, like the old young clothes don't fit us. Similarly, the young vaccination doesn't fit us when we are old. So very often we would have taken TT vaccines, which is the most commonest vaccine. Every time we get a hurt or there is an accident or there is some surgery, our doctors always say, take TT injection. So as adults, the most commonest injection that we would have taken is TT. So that is also a vaccine where you are boosting your already present immunity. In similar way, there are a lot of other vaccines also which we require as adults, especially pregnant women. So many pregnant women during their 7th or 8th month, their gynecologist would tell them, take a TT vaccine. Earlier, we used to recommend TT vaccine, but right now the latest recommendation is something called Tdap, which is vaccination against tetanus, diphtheria and acellular pertussis. So this helps the child in the womb to develop immunity against pertussis. Third, right now it's a season for chickenpox. We always say chickenpox is a childhood disease. So if the child is not vaccinated, child doesn't have a problem. He develops a mild disease and he develops active immunity. Like I said, active immunization. The child gets an infection, develops immunity. But as an adult, many times we have not had chickenpox as children. We may develop chickenpox when kids in our house develop chickenpox. In those situations, if we take chickenpox vaccine as adults, as soon as we are exposed by a child in the house, we can protect ourselves from chickenpox. Chickenpox in adults, if you've not had prior immunity, can be a severe and life-threatening infection. Another important aspect of adult immunization is travel vaccination. There are a lot of students traveling abroad for their studies. They stay in hostels. So their college requirement says that they need certain vaccines like meningococcal vaccines. Meningococcus is a bacteria which causes brain fever, which can be prevented by prior vaccination. They also require measles, mumps, rubella vaccines. A lot of us would have received measles, mumps, rubella as child, but they need booster dose as adults before traveling abroad to certain countries, especially United States of America. There are certain other vaccines recommendations like yellow fever vaccine, which is required when you travel to South America. So travel vaccine is another important area where adults require immunization against certain diseases which can be acquired when we travel abroad. Vaccines don't save lives, but vaccination does. So take your vaccines to save your lives, protect your lives.